Hello everyone, welcome to my YouTube channel. My name is Onesimus and you're on Onesimus the Fashionable Nurse. We are going to continue with peptic ulcers, and in this tutorial we are going to look at signs and symptoms of peptic ulcers. We are going to look at complications of peptic ulcers. We are going to look at diagnosis, and then we are going to look at prognosis of peptic ulcers. But before we continue, please consider subscribing by hitting a subscribe button down in the corner here and click on the notification bell so that you will be the first person to receive the videos whenever I post. Thank you. If we are to look at the signs and symptoms of peptic ulcers, number one, someone will present with stomach pain. And there are two ways how the pain can present, how stomach pain can present. There is pain which is released on eating, and there is pain which is increased on eating. And this is how we can differentiate gastric ulcers from duodenal ulcers. For someone who has duodenal ulcers, his pain will be increased on eating. And for someone who has gastric ulcers, his pain will be reduced on eating. For example, like if you have pain and you eat food, it will be reduced. But for someone who has duodenal ulcers, if you eat food, instead of pain reducing, it will just worsen. Then another sign, also someone will present with bloating. You will be feeling like your stomach is full, even though you have not eaten anything, but you always feel your stomach is always full. Even when you eat something small, you become full very fast. This is because sometimes also ulcers can lead to the blockage of food passage due to the inflammation. So most of the contents of the GIT remain in the stomach and they keep the stomach full. And this one can also lead to vomiting or nausea. Then also someone will present with low appetite. Also there will be passing out of black stool, but this one will come at the later stage when now someone is presenting with also internal bleeding. You will start passing out black stool. This black stool shows that there is bleeding in the GIT. Then also someone will feel sick, most especially when ulcers have taken a long time without being treated. Someone will start feeling weak and sick. Then there is also weight loss of weight, because the food passage is blocked. There is low rate of digestion and absorption of food, so this will lead to loss of weight. Then if you are to look at the diagnosis, your doctor will first take your medical history about your signs and symptoms and drugs you are taking, for example NSAIDs, and you should be there to tell him the truth. Then secondly, you may perform a physical examination to rule out some things. For example, you may do palpation on your abdomen to check whether there is tenderness or whether there is bloating, and he may do auscultation, check on the bowel sounds, whether the bowel sounds are abnormal or normal. And he may order for lab tests. For example, he may order for stool analysis. They collect your stool to check for the presence of H. pylori, or they do blood test also to check for the presence of H. pylori. Then also they may also perform urea breath test. This test includes giving you a special fruit that contains urea, and when H. pylori is present, the GIT, it changes that urea into carbon dioxide. Now they collect your breath to check for the presence of carbon dioxide. If the presence of carbon dioxide is more than the normal percentage, then they confirm that you have ulcers. Then also, your doctor may perform endoscopy and biopsy. He will use an equipment called an endoscope to view inside your stomach to check for the presence of wounds in the stomach. And he may use that very endoscope to pick some tissue sample, what we call biopsy, to rule out the presence of cancer. Then if you are to look at the prognosis of peptic ulcers is good so long as it is treated at an early age. Ulcers can be cured, but the problem is most people keep on getting exposed, so recurrences are very many. And now if we are to look at complications of peptic ulcers, the major complication is internal bleeding. Most people who have stayed with ulcers for a long time, they present with internal bleeding. And secondly is perforation. The bacteria drills holes in the stomach. It makes some holes in the stomach. And also, according to research, most of the patients who have been with ulcers also present with gastric cancer. So, gastric cancer is also one of the complications of ulcers. We have reached at the end of our tutorial. Thank you for watching. Please don't forget to subscribe. Don't forget to like. And in case you want to share with me anything, please put it in the comment section. And if you see this video can help anyone else, please share it. Thank you.